Good evening, everyone. I'm Marisa Gregg, our Interim Vice President for Communications for the college, and I want to welcome you to tonight's webinar. We have an hour for our call. In addition to Father Boroughs and members of the executive team, we are grateful to be joined by Dr. Helen Boucher. Thank you to all of you who submitted questions in advance of today's webinar. We've captured them all, and while we won't be able to answer them all tonight, it's important that we understand them so that we can address them when we communicate our plans in July. You can submit questions during the call using the Q&A function on your Zoom control panel. I would ask that you hold any questions that are not directed to Dr. Boucher until after that portion of our call. As we have more information, we'll continue to update our Fall 2020 section of our COVID website. The COVID site is linked from our homepage. I also want to let you know that tonight's webinar will be recorded and we'll send the link to all students and parents in the next couple days. With that, I'll turn it over to Father Boroughs.
Thank you, Marisa, and welcome Holy Cross students and parents, and thank you for joining us. I believe there are over 1,400 of us on this call tonight. As we all live into this once in a century, we hope, pandemic, where all of our normal ways of living and relating have changed overnight, and as we grapple with the economic recession that the pandemic has occasioned, and as we actively engage in long overdue efforts to end racial violence and racism, there is hope, weariness, grief, anger, and a desire for change moving through our communities and our country. And on our campus community, all three are playing an unsettling role as we approach a new academic year. Amit Taneja, the Associate Provost for Diversity, Equity, and Inclusion, in the next day or two will be presenting a report on current and future actions the campus is and will be undertaking to respond to the Black Lives Matter movement, which has touched us all. We as a people and we as a campus have lots to do, and we want to sustain the energy of the moment to promote real change. Clearly, we have a lot to learn together in doing so. Tonight, as we look ahead to the fall, we will begin our conversation with a reflection of where we are in our commitment to open our campus with the proper health and safety plans. And as you will hear over and over again, these issues are not only complex, but rapidly changing. And while we work steadily on them, we're adjusting daily to new developments. We are on track to announce our plan for this coming academic year in early July, as we have consistently said. And at the same time, we know that in the end, it is the movement of the virus, the promulgation of state regulations, and the development of treatments to test, monitor, and ultimately restrain the virus that will dictate what is possible or not. And as we learned in March, our reality can change very quickly. As Marisa said, we've received from many of you hundreds of questions, and a large majority of them on very specific issues. We can't get into such great detail in an hour's conversation with 1,400 people, but as Marisa said, we're chronicling them so that when our specific plans are announced, we can address them over time. And since the health and safety of our students, faculty, and staff has to be the starting point of any plan to reopen, we have invited Dr. Helen Boucher, the Director of Geographical and Infectious Diseases at Tufts Medical School, to begin our conversation tonight. Helen is a member of our Board of Trustees and is on its executive committee. She is a graduate of the class of 1986 and her husband Norm of the class of 1985. She's an extremely dedicated alumna and a very constant resource for our work now and in the years past. Yesterday afternoon, in a similar town hall with faculty and staff, Dr. Michael Collins, Chancellor of the University of Massachusetts Medical School and alum of the class of 1977, addressed our campus as well. And both have been of invaluable help to us, as has Dr. Anthony Fauci, class of 1966. Now, as Marisa indicated earlier, Helen will present for about 15 minutes, and then we'll respond to some questions we have received. And after that, a few members of the administration will then respond to other clusters of concerns that you have raised in the questions that have been sent in already. Dr. Boucher, welcome.
Thank you very much, Father Boroughs, and good evening, everybody. I'm just going to share my slides. And I'm just going to start by saying really honored to be with everybody. And by way of introduction, besides being a physician who's been very involved in this epidemic for the past several months, I'm also a mom, and I have a daughter, Caroline, who is going to be a senior in college at another Jesuit institution that shall be nameless, and Allie, who's going to be a junior in high school. So we're certainly dealing with these issues in our family and the uncertainty that is so difficult for all of us. And I just want to start by acknowledging that. As we begin, I'll try to give an overview about the disease of COVID-19, talk a little bit about some of the mitigation measures, where we are in Massachusetts, especially for those who aren't here, and some of the concerns that we need to think about in any decisions about reopening. So with that as a preface, the disease COVID-19 was originally called Wuhan pneumonia, based on this disease that popped up in Wuhan, China, which is like the Chicago of China, back in December. And on January 7th, the Chinese authorities identified the virus, the SARS-CoV-2 virus, which is the etiologic agent of COVID-19. And very importantly at that time, very shortly thereafter, we knew that human-to-human transmission was confirmed, and that began sort of this odyssey that's been going on for the past 6 months. So just to provide some perspective, on February 26th, this was the map of the world, and there were 85,000 some odd cases globally, and you can see all the red dots in Asia at that time. We were hearing about this on the news. There were 0 cases in Massachusetts and 0 deaths on that day, less than 3,000 deaths globally. Fast forward to today. Today, here's the globe with all the red dots you can see. Over 8 million infected people around the globe, and you see the extensive disease in the US and Europe and Asia, which we know about, but I'd like to direct your attention to the Southern Hemisphere, countries like Brazil, Peru, Africa, lots of countries in Africa, Pakistan and India, where the epidemic is raging, and we're quite sure that the numbers are a significant underestimate. The humanitarian issues that go with this are huge and deserve a lot of our attention. It's also important for us because this is their respiratory flu season and may forebode what we'll see this time next year. In terms of global deaths, we have over almost 500,000 deaths reported globally. So this is a disease that travels in what's called exponential growth. And you could see that with the numbers we just looked at, but just to give you a little more perspective, it took 67 days from the first reported case till we got to 100,000 cases. Then 11 days for the next 100,000, 4 days for the next, 3 days for the fourth. So this is raging at this type of a pace. So let's look at the United States. These are the numbers from this morning. Over 2 million infected individuals in our country, 116,964 deaths reported. The rate of infection is about 20,000 a day. In terms of deaths reported a day, between 500 and 1,000, and that unfortunately has been stable. The other thing I wanted to draw your attention to is the fact that we are seeing, troublingly, a number of states with increasing hospitalizations due to COVID-19. This is not due to increased testing, this is due to increased disease. So states like Arizona are operating in crisis capacity, Florida, Alabama, South Carolina, to name a few. And these states opened on the dates you see here on the right. And importantly, many of them opened and socially opened in the setting of increasing numbers of infections being reported. And that is different than what we're going to see in Massachusetts. So I just wanted to highlight that. So what is this disease? It's a respiratory illness, as you all know, caused by a coronavirus that causes common colds, but also really dire diseases like SARS and MERS. This agent, the SARS-CoV-2, is a novel or new coronavirus and is transmitted just like influenza and other cold viruses by the respiratory route. So droplets need to come into contact with our mucosal surfaces and our eyes, mouth, and nose. That's how they infect us and cause all the havoc that they do. The other issue about this disease that is unique is that there's transmission from people with no symptoms. Some people never get symptoms, and some people transmit in the day or two before they become ill. So that makes it very difficult for us to control. So another kind of principle I want to introduce is this concept of the R naught, or the number of people that one sick person will infect. So this picture that comes from the medical journal of the New York Times, or the Atlantic here actually, shows the R naught for a number of diseases. So hepatitis C on the left, to Ebola. One person with Ebola will affect 2. COVID, the R naught is about 2 to 3. It depends on the setting. It's very much less infectious than diseases like mumps and measles, which we are seeing. So it's important to keep this in mind for perspective as we talk. And as we come to testing, we'll come back to this because it's an important concept. So what does this disease look like? So once someone is exposed to the infection, the incubation period is usually around 5 days. Most people become ill at about 5 days after exposure, but it can be as long as 2 weeks. So that's why all the measures that we put into place for people who are exposed go for 14 days. Most people who become ill get a cold, a sore throat, body aches, kind of flu-like symptoms. We've learned, however, that a lot of gastrointestinal symptoms occur as well. Things like diarrhea, vomiting, loss of appetite, but some funny things, including loss of smell and loss of taste that you've probably heard about by now. Chest x-rays are very, very abnormal, and there's a lot of lung manifestations when people become ill. So the clinical course is very important. 80%, the vast, vast majority of people have no or very mild illness, but a very small percentage get very, very sick. So the timing is also unique here. This is what we call a biphasic illness. The first week of illness in most people is quite mild. It's a small number of people who become ill in that second week, around days 8 to 10, who become sick enough to come to the hospital. And a small proportion of those people end up having to come to the intensive care unit and develop the dire consequences, and unfortunately, end up having the bad outcomes and deaths that you hear about. And sadly, many of us know people now who have succumbed to this disease. So the risk factors for severe disease, very, very important in this context, right? It's older people, and older is over age 55. So for those of us who are parents, that's pretty depressing because many of us are over 55. But it's also underlying diseases like underlying pulmonary and cardiovascular disease and diabetes. So study after study are showing that these are the risk factors for doing poorly. There are a number of other markers that we follow in terms of laboratories, but again and again, it's older individuals as well as those with underlying disease who we need to be the most concerned about doing poorly with this disease. So the complications I'm sure you've seen on TV and in the news include everything from pneumonia, very significant lung injury, heart effects, including direct infection of the heart, abnormal rhythms, and other kinds of cardiac injury, a lot of bleeding and clotting issues. And then this recently reported illness in children that's an inflammatory syndrome like Kawasaki syndrome, with the picture shown here. Fortunately, extremely rare, but something that we have much to learn about. And again, for a disease that we've known about for only just over 6 months, we've learned a lot, but we have a great deal to learn. So here's a look at the mortality rate, and the age message comes back here. You see that in young people like our college students, this is a largely very benign disease, but in older individuals, the mortality rises to 15% in individuals age 80 and above. Very, very important for us to think about that in all of our interventions and the way we think about this disease. So how do we deal with it in terms of thinking about reopening? And we have plans at the US level, and there's Dr. Fauci in the bottom right, who is on the White House task force and has been a true hero in fighting this epidemic and leading the country and speaking to us clearly about what's going on. So we have a US plan that's shown here, and then we have statewide plans. And all of these are based on the 3 T's. So testing, treatment, and tracing. So testing, we're going to talk quite a bit about. Treatment is a very broad definition of treatment here. It's having the ability to treat patients without going to what we call crisis standards of care. So it's having enough doctors and hospital beds, ICU beds and ventilators, and all the protective equipment we need to take care of patients. Then tracing is the ability to, once we identify someone who's infected, to be able to find out who they may have exposed and to trace and isolate and quarantine those individuals. for a 14-day period. So very, very important principles of how we think about opening up our society. So here in Massachusetts and in many other states, we have a 4-phase approach. We're in week 2 of phase 2, the cautious phase, which means a number of things are open. Our hospitals are operating almost back to normal. We're doing everything except cosmetic surgery. A number of businesses are open, but not all. And the governor is looking at data every day to make decisions as to whether we're going to go to the next phase as soon as next week, actually. So likewise, for higher education, there in Massachusetts, we have a governor's task force who's been working on this, and they likewise have a 4-phased approach to thinking about reopening colleges. And we need to be in phase 3 for thinking about things like repopulating residence halls, dining halls, and classrooms, very relevant for Holy Cross. So the green is what we're looking for. And all of those kind of measurements that I just talked about are relevant in the college setting as well. So here's the data that the governor looks at every morning as he thinks about how we're doing. And this is the data for Massachusetts from yesterday. They come out late in the day. So whether we look at the test positivity rate, which is down 91%, is a very important marker of making progress in our fight against the virus. Whether we look at the number of patients in the hospital, the numbers of hospitals operating in what we call surge capacity, or the average numbers of deaths, all of these markers are significantly improving in our state, which is great news. Here's a look at the epidemic curve for hospitalized patients with COVID-19 in the state of Massachusetts. And you see that our peak was in late April, both for the numbers of hospitalized patients, just under 4,000, and those in the ICU, just under 1,100. And as of this morning or last night, we had a 74% decrease in hospitalized patients and a 78% decrease in ICU patients. So much, much better. Still not perfect, but much better. Here's a look at the testing data. And testing is extremely important as a tool in how we're going to control this virus, because we have to be able to identify it to be able to stop the spread. So we use this measure of positive test rate to help us as a guide to know that we're doing enough testing and that our efforts to do contact tracing will be successful. And the WHO and other experts tell us that if we get this number under 10%, we have a good chance of being able to execute contact tracing successfully. And indeed, we're well under 5%. The governor wants us to be under 2%, but we're really making good progress here. So that brings us to how do we do it? How do we safely institute measures that will keep us all and our children all safe back at college? So it's this combination of testing, tracing, isolation and quarantine of the people who are exposed or infected, and really aggressive symptom monitoring. One of the most important things is that if you have any symptoms, you stay home or stay in and get tested promptly. And we'll talk a little bit about this. So for symptom screening, many institutions, including schools, have instituted things like this little app that I do every morning when I come to work that says whether I have no symptoms or any of the symptoms listed there. If I check that I don't have any of those symptoms, I get all clear to go to work and I'm allowed in the building. And this is what a number of colleges are thinking about doing in terms of symptom monitoring. In terms of testing, we have a number of tests for the COVID virus. They all have their strengths and their limitations, and we'll talk a little bit about them, but we have national guidelines as well as local guidelines to help us understand how to best use testing. So in our state of Massachusetts, we have a very aggressive testing plan. The governor wants us to push those test positivity rates down even lower. He wants us to be testing 45,000 individuals a day by the end of July and 75,000 by the end of December. And he's very focused on expanding in what we call high-risk congregate settings, places like group homes, college campuses, and correctional facilities. So this is an area of great focus in our state. In fact, the governor stood up a very interesting plan today to open 52 sites across the state to offer confidential testing to anyone who had been out and potentially exposed at some of the protests recently, so that if any infections occurred, we could isolate them immediately. And this is another aggressive way to see if we could test, 10,000 people extra a day in our state, but very innovative idea, I think. So what are the tests that we have? We have two major tests available to us. We have nucleic acid or PCR tests that you've probably heard about. This is the mainstay of testing. This is done by using a swab that's often sampled from the nose and the back of the throat, but occasionally some sites are able to use saliva for this test. It's a very sensitive test. It looks for actual material of the virus. That's the good news. The less good news is it doesn't always tell us if the virus is alive, and so sometimes this test can be positive for a very long time after the illness. It's labor intensive and relatively expensive. We'll talk some more about it. We also have antibody testing, which shows an exposure to the virus and the development of antibodies to that virus. So this test has really important ability to tell us across a community how many people have been exposed to the virus. It's not so good yet at telling us much for an individual patient, and that's one of the limitations of antibody testing. The other thing we don't know yet is if the antibodies that are made against the COVID virus are protective, meaning whether we can still get infected again, and if they're protective, how long that protection would last. Some cold viruses caused by the coronavirus have antibodies that only last for a few months. So this is a real unknown and something that I think hasn't been communicated that well out in the press. So there are a couple of other tests that I'll mention. One is called an antigen test. It's in the second column here. And that's a test like the flu test you might have had. These are great tests. They can be done in doctor's offices very quickly, and they're usually much more inexpensive. The problem with these tests are that they're only usually efficacious during the time of a peak, so like during flu season. And there's some technology issues as well around the development of the science for these tests. There are a couple coming along, and we're hopeful that we'll have some by the time we get to the next respiratory season next fall. Another technique that I'll mention is what's called pooling of testing. And that's where instead of doing a test on each individual person in line, you take the samples from 100 people and run them through the machine once. And you look for any positivity. If they're all negative, you know that all 100 people are negative. If anyone's positive, then you have to go back and run 100 individual tests. But this can be a way to improve what we call the throughput, how many tests we can do quickly and save money on testing. So this is something that's being considered for places like college campuses. That's why I mention it. So here's a little bit more about the antibody. There has been some press from the CDC and others who have shown that unfortunately with the status of antibody testing as we have today and the risk of false positive tests, that in many people, individual people, an antibody test is like flipping a coin. So we shouldn't be using antibody test results to make any decisions about individual people being protected and not having to follow social distancing and other measures to protect themselves from the virus at this time. So a quick word about quarantine and isolation, because these are words that we all have to know, students, parents, all of us. So isolation is when we take someone who is infected with anything, and here it's the COVID virus, and we isolate them from everybody else. So if you get COVID, we need to isolate you in a separate place with your own room and your own bathroom to make sure that you don't spread the disease to anybody else. Quarantine, on the other hand, is for people who've been exposed. So in the period of quarantine, that 14 days after exposure, we need to have you in a safe place where we can monitor you every day to see if you develop any symptoms of the disease. But linguistically and just in terms of the way we talk, isolation and quarantine mean two different things. So what about higher ed reopening? I mentioned earlier that it's going to be considered during phase 3 in the state of Massachusetts. And at that time, the governor says that colleges can consider carefully repopulating residence halls, et cetera. I think there are some important questions to think about. And I don't have the answers, but I think these are things we have to think about. What will the epidemic look like in August? We really don't know. We don't know if what we're seeing in the South is going to travel. We don't know what it's going to look like here in Massachusetts 3 weeks after the social distancing began, because we haven't gotten there yet. Can our spaces be safely reconfigured? I know that Father Boroughs and the team are actively engaged in this effort, but there's a lot of physical things that have to happen to make spaces safe during an epidemic like this. How much testing is enough? Is it enough to just test the students when they come back in every couple of weeks, or do we have to be able to do it more often? A lot of work is going on in this regard, and there was just a report released today, but this is going to come down to a case-by-case, college-by-college decision, and it's going to be driven largely by the virus and that reproductive number that we talked about, that are not. How much transmission is happening will guide how much testing we have to do. Will students follow the guidance about masks, physical distancing, and hand hygiene? This is really hard. And I think something that really bears a lot of thought as everyone thinks about the social compact that's going to be needed to go forward in opening. And there was just a big outbreak at a bar in Florida where I think 22 out of 22 people who went to the bar and got exposed got infected. So we know that these measures are important, but how to implement them is not so easy. The recommendations we have from the higher ed working group are to do phased repopulation, to monitor health, and do lots and lots of testing. To test people who have symptoms, any symptoms, very important, but then to do what we call surveillance of asymptomatic people and to figure out how often, which is a bit of a moving target. In terms of containment, we need to isolate, do contact tracing and quarantine, and then we have to think about, when and how to scale all this up. These are just a few of the questions that Father Boroughs and the team are working hard on as we speak. So as I close, I always like to say, what are the things we all can do to make a difference here and to protect ourselves? So really important. Some of this is really simple, but can't be emphasized enough. Wash your hands, wash your hands, wash your hands. Soap and water for 20 seconds, that's happy birthday twice, or hand sanitizer that has at least 60% alcohol, and do it a lot. Try not to touch our face, which is really, really hard, but that's the way we can infect ourselves. Adhere to physical distancing, that's 6 feet from other people, and we define an exposure as being within 6 feet of someone who's infected for 15 minutes or more without wearing a mask. So if you're wearing a mask, you'll be protected. Avoid gatherings of people. Right now in the state of Massachusetts, the limit is 10. That will probably open up a little bit as we get to the next phase. Avoid anybody who appears ill or who's coughing, and don't go out if you get any symptoms. These are all things we can do. To hit home the point about social physical distancing, right now, one infected person with COVID infects 2.5 people, as you see, at about 5 days. So in 30 days, 406 people will be infected at that rate. If we cut that exposure in half, only 15 people will be infected. If we cut it by 3/4, only 2.5 people will be infected. So spacing ourselves out and keeping that physical distance really makes a difference. Not just in infections, but in deaths. And here's a great graphic from the New York Times that shows that if you can cut the spread of COVID-19 by one person, you will save 25 deaths. So physical distancing and all those measures that we just talked about really, really make a life and death difference. So with that, I'll say thanks very much and look forward to taking your questions.
Thank you, Dr. Boucher. We have a few questions. First one is, what is the R0 for flu?
Great question. So the R0 for flu is about 2. It's about the same.
Okay. Another question is, there was a recent report that asymptomatic people are not as likely to spread the disease as previously reported. Is this true or false?
It's a great question. So this woman at the WHO, a wonderful epidemiologist, I think was quoted a little bit out of context, and that's where that started. And the next day, there was a press conference where she clarified that there is data that asymptomatic transmission exists. What we don't know is how big of a factor it is. The ranges range anywhere from 5% to 40% of asymptomatic people can transmit the virus. We know it's much greater in people who have symptoms, and that many people are pre-symptomatic, meaning it's the day before they get their symptoms. But we don't know for sure what that percentage really is, and that's an area of intense investigation.
Thank you. Could you please comment on recent reports indicating that blood type may affect susceptibility to COVID-19?
Yeah, very interesting. And this is fascinating, but there are reports that people with certain blood types are protected from COVID. And the thinking is that the protein on the outside of the red blood cell prevents the attachment of the virus. So this has been shown with other coronaviruses. There's a lot of biologic plausibility, and there's a lot of study going on to see how important a role this may play.
Great. How do you recommend that people handle groceries for people that are high risk?
Yeah, great question. So the vast majority of transmission is person to person. So it's really important to think about the trip to the grocery store for the person going to the grocery store and wearing your mask and doing a really good hand hygiene after touching all the things in the grocery store, like the cart. The groceries themselves, I think that there is evidence that the virus exists and persists on different, what we call high-touch surfaces like doorknobs and countertops. There is some evidence that it can survive on paper bags and things like that, but not very much. So I don't advocate that you have to wipe down every grocery. I think, empty out the bags, put the groceries away, and then wash your hands is perfectly safe. There has been no documented case of transmission through what we call fomites, things like a box of groceries or a bag of groceries.
Thank you. And one final question. Do you have a perspective on herd immunity?
So herd immunity, the idea is that, and many people talk about this, that the way this virus will be controlled is when 60% of people, 40 to 60% of people are immune. And that can happen in two ways. One way is vaccination, which is what we all hope for, and we hope for a vaccine soon. The other is herd immunity, meaning that many people have become infected and recovered and developed immunity. The problem with herd immunity is you have to live through the infections, and Sweden tried this experiment and it did not go well. They had a lot of deaths and changed course. But the other premise is that the antibody protection would be lasting. And we don't know that yet. We don't know that these antibodies will be lasting. So herd immunity may not be easy with this virus.
Great. Well, thank you so much. We really appreciate your being with us.
Thank you.
Some other questions. We had a number of questions come in about our plans for testing and other health and safety measures and how they'll impact certain facilities on campus. So I'm going to ask Michelle Murray, our Vice President for Student Affairs and Dean of Students, to talk about some of our plans in this area.
Great. Thank you, Marisa. And thank you, students and families, for your questions. I do want to underscore that we are on track to announce our actual plan in early July. So right now, I'll speak briefly about some of our health and safety plans, what we are working toward. First, we are working to design testing protocols right now, but as you just heard from Dr. Boucher, the guidance on testing is changing by the week. And so we are partnering with doctors from UMass Medical and from Tufts Medical Center to develop protocols and better understand what our testing and contact tracing will look like in August. We are also developing health and safety guidelines that will include specific directions related to testing, symptom tracking, social distancing, wearing masks, and other measures. Because as you know, as Dr. Boucher discussed, the age group of our general student population experiences more mild symptoms from COVID-19. However, our campus includes faculty and staff from across the age ranges, and so it's important that all of us on campus recognize our responsibilities to one another and adhere to the health and safety guidelines that we will be sharing with you after we announce our plans in early July. Some of you have asked some questions about facilities, and I can tell you what I know right now. We are reviewing all of our spaces to determine whether they can safely reopen. We are working on a plan, for instance, for dining, which will include spaces what spaces open and what the offerings will be. We may be limited to grab and go options, which is different from what students are used to, in order to encourage social distancing. And we may need to eliminate the handling of plates, cups, and utensils. So we know that whatever it is, it will look different from what we are used to. We are looking into tents to supplement dining and other gathering spaces that will also allow us physical distancing. We are also looking at plans for the libraries and how we might open some of our workout spaces in accordance with public health guidelines. And certainly the Commonwealth of Massachusetts will have protocols specifically for reopening gyms. We will have distancing expectations for sure and cleaning protocols for all of these spaces, which will be communicated like everything else to all of you. Our plan will include space for isolation for students who test positive for COVID-19, as well as space for those who must quarantine due to possible exposure, as indicated by contact tracing. So those are some of the plans that we have around health and safety regarding some of our spaces, and I'll pause there for now.
Thank you. I have a bunch of questions coming in. I'm going to direct to Father Boroughs. How many students are we hoping to welcome back? What are we working towards in terms of bringing students back to campus in numbers?
It's very hard to predict numbers at this time because we're hoping to have the campus open, and we recognize that there are limitations, that some students are immunodeficient and it's not a safe environment for them. Whether we're have a large number of students here or we have a smaller number of students will depend on students' decisions. It also will depend on how we're going to be offering classes, because no matter what we do, a certain percentage of our classes will undoubtedly be online, even if students are here, because the professors themselves are in vulnerable categories. And the other issue that's very complicated for us is this whole space analysis we're doing, that most of our classrooms are not set up for 6 feet distance in every direction for students. And so what normally seats 25 might seat 4. So as a consequence, we have to look at a whole lot of different ways of communicating and teaching, and that's being really analyzed right now. We do, again, the board and the administration will be meeting over the next week and a half or two, so that by early July we can say what we're exactly going to do.
Thank you. We've also had a large number of questions about the academic program and changes to the academic calendar. I'm going to ask Margaret Freege, Provost and Dean of the College, to speak to some of those questions.
Thank you, Marisa. I'm happy to do so. So as Father Boroughs outlined in his email last week, we are modifying the academic calendar. We're eliminating the October break, and the on-campus component of the semester is going to end prior to Thanksgiving. The rest of the semester will then be completed remotely. We did this because it's inadvisable to have large groups of students on campus, have them then go and spread across to various home sites and then come back to campus. And so we want to make sure that we're keeping people together once they're on campus. Courses, as Father Boroughs said, are going to be a mix of in-person and online formats. We're going to try to meet the needs of both students and faculty who are unable to come to campus. And also we have to work within the space constraints that Father Boroughs already outlined. We're working to determine this mix now. We're working with faculty to determine which courses how they want to teach their courses, what makes the most sense pedagogically to them. And we will be able to communicate some of that information once we have a decision in early July. We're also planning to offer a 3-week January term. This will be a term in which some students will be able to take a course. There'll be some courses offered in person and some courses offered online. This is an opportunity for faculty to create immersive courses for students. Again, there's not going to be as many courses we offer during a regular term, but depending on the course of the virus, we may set up a similar model for the spring semester. That is, we'll have a spring term followed by a May term, but we're gonna have to let the virus determine that.
Thanks, Margaret. Many of you have asked about housing and some other aspects of student life. Dean Murray, could you speak to some of those questions?
Yes, thank you. As you might have guessed, assuming we are all back on campus, we will experience some different conditions related to housing and student life. We will be making some changes to housing configurations to de-densify our residence halls, and that means that we are planning for no more than 2 students per room. In order to de-densify and create space for isolation and quarantine, we will need more rooms. So we are talking with multiple apartment complexes close to campus, as well as evaluating solutions such as modular apartments. We will have more information shortly on the different options and how the process for housing selection will work. Some have asked about move-in dates. We will have to stagger move-ins so that students and parents can socially distance. We don't have specific dates and won't until students complete their housing assignments. As far as student life goes, it certainly will not be what we are used to. We won't be able to hold large events and gatherings, and we will have to modify many of the activities and events that regularly happen on campus. We have a large group that is working very hard on plans for modifying or creating new programming that will meet the guidelines on campus and also that will be able to be accessed remotely. And so I want you to look for those.
Thank you. Margaret, this is a question for you. Will students have the option to stay at home and complete the semester entirely online?
Yes, students will definitely have that option. As I said, we're going to be offering a number of courses online, and faculty are also planning for other creative online opportunities that will be available to students who may not be able to return to campus.
Thank you. Dean Murray, what happens if a student tests positive for COVID-19? Can you talk about that a little?
Sure. So a student who tests positive, or students who have been identified through contact tracing as having been exposed to an infected student, will be required to isolate or quarantine respectively and monitor their symptoms. Per our usual protocols, we will be asking those students who live within a reasonable distance to campus to convalesce at home, just as we do with students who become ill with the flu or some other highly infectious virus. There will be limited exceptions granted depending on students' families' health situation, and students who are unable to return home will be able to isolate on campus, and their medical care will be coordinated through health services.
Thank you. We have a number of questions about study abroad or semester away programs. Provost Friege, could you talk to that and when we might hear about those decisions?
Yeah, so we are monitoring the situation in study abroad at all of our site institutions to see which ones are going to be open. And of course, as you know, travel is restricted right now, so it's a little bit hard to get you to study abroad sites. We will announce what we're doing with study abroad at the same time that we announce what's going on for the fall semester on campus. I did notice there were also some questions about whether students would know the format of courses, and that's our plan. Our plan is to gather all that information so that we can give it to you in July before open enrollment period.
Thank you. Dean Murray, there are some questions about enforcing health and safety protocols and how will we ensure that they are adhered to?
Sure. So we are working on a community covenant to which all students will have to agree in order to return to campus. And this will include some of the guidelines I mentioned before about submitting to testing, wearing masks, social distancing, and that kind of thing. These are the guidelines which we will expect everyone to adhere in an effort to keep our community safe. There, of course, would be consequences for violating the covenant up to and including being sent home or a revocation of on-campus privileges. And these will all be laid out in the agreement.
Thank you. Father Boroughs, we have a number of questions about athletics, and do we have any information about intercollegiate athletics for the fall?
Sure, thanks, Marisa. On Friday, I will be attending a board meeting of the Patriot League, and it'll be a group of presidents and 8 athletic directors. And at that time, we hope our league policies will be developed. So I don't have a specific, I know this must be a little frustrating. Everyone wants something definite, and yet realities move in such a way, and I the number of presidents have been talking about how we're going to frame this, and our athletic directors are talking about it. So my hope is that we will have a league response very shortly.
Thank you. While I have you, will the college be discounting tuition for the fall semester?
At this time, the board has not, is looking at all of these questions, and we're discussing it in more detail. Again, we have a board meeting coming up as well to talk about our financial plan and to talk about how that connects with the number of students that will be on campus. I also want to say, and I recognize, I know another related question is some are saying, well, should I, if classes, a lot of classes are going to be online, should I just take classes elsewhere online and come back in the spring semester? I realize, and some or others talk about deferments or a gap year. And I realize that given the economic realities we're all facing, we're certainly trying to take that into consideration at the college, both in terms of tuition and in terms of financial aid. I also realize that families have to make unique decisions based on their own economics during this really difficult time. That said, I guess one of the questions is, if you were only taking a class, online class, that's one kind of an experience, but that's not the Holy Cross experience, because all of our clubs, all of our organizations, our sports teams and coaches and chaplains and counselors and health centers, all of them are still open and caring for students. One of our chaplains the other day was telling me, he said, I'm doing more one-on-one spiritual direction and counseling right now than I've ever done. And I'm doing it all online as the needs obviously are increased. So all the programmatic pieces that we're doing mean that a Holy Cross education is what happens in the classroom, of course, but it's a community that you join, the way you connect with that community, and all the programmatics that are being offered. And as you can imagine too, as we talk about returning to campus, we're projecting anywhere in numbers from 11 million to $18 million of COVID resourcing that will be necessary to protect the members of our community in this coming year. So there's a whole lot more than just taking a class online and being part of this community that we're providing for our community members. And I hope that as families discern what's best for them and for their students, they will think about all the range of the possibilities that are there and the relationships that are being continued by the same faculty members, your advisors, your mentors, our alumni community, and all that's part of what it means to be part of Holy Cross.
Thank you. I think the majority of questions that are coming in are very detailed. Probably we don't have answers to many of these at this time, but they will be included in our plans when we communicate them in early July. So I will leave it with you, Father Boroughs, for wrapping up.
Okay, thank you. I'd like to offer my special thanks to Dr. Helen Boucher for joining us today. As she indicated, she's not only an infectious disease physician, she's a mother of 2 daughters, and her perspective is both very helpful and so are her cautions. As the college prepares to welcome students back, and we hope we can welcome back as many as possible, it is critically important for students and their parents to understand that life on campus is not going to be business as usual. We know that health and safety protocols will change our patterns of living and studying and recreating and interacting. How all of us, students, faculty, and staff, care for each other by observing the protocols which are demanded in this time of crisis will save lives and will keep the college open. Because if we have a significant outbreak of the virus on campus, we will rather quickly have to shut it down and send everyone home. And it's also clear that the lives of many of us who work here are seriously endangered if the virus takes hold of our campus community. I know many of our faculty members and staff members are very concerned that students will observe behaviors during class days and regular hours, but in evenings or on weekends, the discipline will disappear and put all of us at risk. Now, I've said to some, life next semester will be somewhat like a boot camp. We're going to have clear norms and obvious protocols and limited behaviors and really big changes in how we go to class and study and take our meals, and most of all, how we recreate. It is not going to be easy, and we'll all have to conform to the protocols necessary to keep the infection down. But on the other hand, all of us who've actually gone through some form of boot camp whether as cadets in the military or novices in religious life or interns in Wall Street firms or medical students or parents with more than one preschooler, we all know that sharing these life-changing experiences with others actually not only becomes a point of pride, but a place where challenges well met generate character, a shared history which lasts a lifetime, and a sense of what true community can be when we selflessly live for others. So students, if you're up for this challenge, come to live on Mount St. James in the fall. Students, if it is better for you to take classes online for the first semester, then please sign up for that. Just know what you are choosing and why, and take responsibility for your choices. And hopefully I'm going to see many of you here in late August, and I can assure you that we will never forget what we share in this challenging time together. Thanks so much for being with us tonight. We are going to be having more of these town halls later in the summer, and when we can communicate more effectively with you again. Thank you all, and God bless you all.